Curious to get your thoughts on how a patient should evaluate the risks and rewards of taking a newly approved medication. Obviously, we get lots of safety data from trials, but there are limits on how long term that can be. I think about this in the context of multiple medications that I'll be on for the rest of my life and for which I am in the first generation of people taking them. And I'm curious to get your thoughts about evaluating the decision in general. Pretty good question. And again, we should clarify that it's not medical advice. So, like, don't start or stop any medication based on what we are discussing here. But I go back to the thing about they're having known knowns, known unknowns, etc. And so, as far as known knowns of a medication and a particular medical condition, to the extent we know what are the risks of not treating the condition versus any established benefits of taking the medication, presumably because if someone's on a quote newly approved medication, this is proven to be either superior to existing treatments. Perhaps it's the only treatment available. That could be another option. Or the fact that it has less risk than other existing medications or treatments with a similar sort of benefit. And so those things can be sort of known ahead of time. What we don't know, these sort of like known unknowns, what are the long-term data? And I think about like the anti-obesity medications, for example, with respect to treating obesity over like a 15-year, 20-year period. That data doesn't really exist. We have people that have been using GLP-1 receptor agonists for diabetes for decades, so that makes us feel a little bit better about their safety profile long term. But as far as if somebody asked, how confident are you that GLP-1 receptor agonists, for example, are net benefit to individuals with obesity after 20 years? I would personally feel pretty confident, but not as confident unless if there was a 20-year trial, like exactly, over with a large swath of the population being involved there. That would be like the definitive study to be like, I feel even more confident, but we don't really know. And then my last part of line of thinking here has to do with the stakes that are at play here. So, like, what would happen if you didn't take this? So just like playing that out. And there's a difference here between like vitamin C and chemotherapy, for example, right? If someone's like, well, I'm going to take vitamin C because I think it does X, Y, and Z. And it's like, well, maybe there's not a lot of data to support that, but ultimately, what are the potential risks? And like, if you didn't, it's effectively not a big deal. You probably feel that way about vitamin D. The patient's like, I'm taking vitamin D. And you're like,
Totally.
I don't think it's doing anything, but like, whatever, man. On the other hand, if you had a patient that was like, I'm rejecting chemotherapy for this very treatable type of cancer, like a renal cell carcinoma, for example, and you're like, I don't think that's likely to end up well for you. So the stakes matter.